We begin tonight with the Rhode Island Department of Health's plans for what to do if and when a coronavirus vaccine is discovered. Good evening, I'm Mike Montecalvo.
And I'm Kim Clooney, and the CDC has set a deadline of November 1st for each state to submit their plans for how they will distribute the vaccine. With the deadline just 2 weeks away, Health Department spokesperson Joseph Wendelken shared with 12 News this 51-page draft plan, which details who would get the vaccine first, how and where it would be administered, and what we would need to do if someone needs a second dose.
According to the plan, the vaccine would be rolled out in phases to certain prioritized populations. The first to receive the vaccine under the current plan would be high-risk healthcare workers and first responders. The shot would then be rolled out over time to others like people with serious health conditions, K-12 teachers, and critical workers in high-risk settings.
The final phase of distribution would prioritize young adults, children, and workers in industries that are critical to society. We asked Wendelken about where it would be administered.
We do envision having community place-based sites where people would go and get vaccinated. Usually what we try to do is make it as convenient, as accessible as possible. Again, there are a lot of unknowns about how much vaccine will be available, when it will be available, but our focus is definitely trying to make it as accessible as possible in the community.
Now, this report says the state learned from the 2009 swine flu outbreak and from the seasonal flu. Wendelken says while a timeline for a vaccine is still unknown, the state will be ready to administer it when it is available.